Hi everyone, my name is Alexis Anderson and my disorder is called pyromania. I hope you enjoy my presentation and you learn a little bit about this disorder. So once again, my name is Alexis Anderson and my condition is pyromania. Since pyromania is a very rare disease, I'm sure not many of you have heard of it. In brief, pyromania is an unhealthy obsession with fire and the observation of the aftermath. When a person with pyromania has a buildup of tension, it can only be relieved by deliberate fire setting. This cycle of behavior is what creates pyromania. A person diagnosed will start a fire at a frequency of once every 6 weeks. This disorder used to be seen as insanity or as a criminal act. To be diagnosed with pyromania, you have to be seen by a psychiatrist. The average age of diagnosis is around 18 years old. According to the DSM-5, there are 6 criteria that must be met. Those 6 criteria are deliberate and purposeful fire setting on more than one occasion, tension or affective arousal before the act, fascination with, interest in, curiosity about, or attention to fire and its situational contexts, pleasure, gratification, or relief when setting fires or when witnessing or participating in their aftermath. The fire setting is not done for monetary gain, as an expression of socio-political ideology, to conceal criminal activity, to express anger, to improve one's living circumstances, in response to delusion, or as a result of impaired judgment. The fire setting is not better explained by conduct disorder, a manic episode, or antisocial personality disorder. Next, I'm going to be talking about the etiology. Since this disorder is so rare, there is little research. This disorder is believed to be targeted in childhood, and things like abusive family environment or mild brain trauma can play a factor. Another factor of the etiology is people seeking sensations such as seeking attention, poor supervision, peer pressure, or stressful life events. The misuse of drugs is also considered an etiology. Lastly, learning disabilities is seen as an etiology because diagnoses are linked to lower IQ. Pyromania is an impulse control disorder, meaning they are unable to resist a deconstructive urge. The exact part of the brain responsible is unknown. In an article I read, it said that we don't understand a lot about depression, let alone something as uncommon as pyromania. They believe it may be related to certain imbalances of brain chemicals, stressors, or genetics. Neurotransmitters like dopamine and serotonin assist in regulating the impulse control and may be influenced by our genes. Now onto the incidence of pyromania. This disorder is predominantly a male condition. In a landmark study of 1,145 fire setters, 2/3 of that population was male. Overall, 90% of the diagnosed are male. Of the 9% of the population that has an impulse control disorder, only 1% of that is diagnosed with pyromania. More specifically, an adult psychiatric inpatient was only 3.4%. It is said that 14% of fires that are started are caused by people with pyromania. As you can see, this condition is very rare. We are now moving on to symptoms. The biggest symptom of this disorder is a fascination, interest, or curiosity with fire. People diagnosed with this condition can be caught watching fires in the neighborhood, setting off fire alarms, or even getting pleasure from institutions, equipment, and personnel with fire. People diagnosed can be seen spending time at local fire departments or becoming a firefighter. Lastly, they'll be seen experiencing pleasure or relief when starting a fire, witnessing the effects of the fire, and participating in the aftermath of a fire. The symptoms mentioned on this slide are actually more general to all impulse control disorders, but I still think they are relevant because they can be seen in people with pyromania. First, we're going to look at the behavioral symptoms, which are aggression, playing with fire, or lying. A physical sign or symptom that possibly can be seen is burns on the skin. And lastly, the cognitive or psychosocial symptoms that you'll see is agitation, irritability, lack of patience, difficulty concentrating, obsessive thoughts, social isolation, depression, or brief periods of emotional detachment. In this specific disorder, the obsessive thoughts are based around fire. The prognosis of this disorder really just depends on when the disorder itself is diagnosed. If this disorder is caught at a young age, which most of the time it is, the prognosis is rather good. If the disorder extends into adulthood and goes untreated or undiagnosed, it can result in legal difficulties because of the destruction or harm it can cause. You can help the prognosis if the client is given a positive therapeutic relationship and strong motivation to change. This disorder has a normal lifespan. Once again, it is mainly seen in males and occurs more commonly in adolescents. 60% of the cases occur before the age of 15, but the peak age for developing this condition is between 12 and 14. The earlier you diagnose and treat this disorder, the better outcome you have. In an article I read, it said that the earliest diagnosis that has been seen was in a child as young as 3 years old. A diagnosis at this age would be rather hard because all people have some level of fascination with fire itself. There are a couple of related disorders and risk factors for this condition, a few of them being antisocial personality disorder, obsessive-compulsive personality disorder, impulse control disorders, and bipolar disorders. Pyromania and mood disorders are common in 61.9% of people with this condition. Also, about 10% of people that have pyromania also are diagnosed with depression. Lastly, about 33% of people with pyromania also have substance abuse disorders. There are two main types of medical management for pyromania, the first treatment being medications. Some of the medication given are mood stabilizers such as lithium and an anti-epileptic medication. A combination of neuroleptic medications are given such as olanzapine and anti-epileptic sodium valproate. Another treatment is cognitive behavioral therapy, which is a type of talk therapy. It focuses on thoughts, behaviors, and emotions. It asks the questions, what we think affects how we feel and act, what we do affects how we think and feel, and what we feel affects what we think and act. There are two other treatments talked about, and those are relaxation therapy and awareness therapy. Awareness therapy is becoming aware of your emotions and feelings. In this slide, I broke the medical management up between children and adults. The treatment of children is very individualized and it's based on history. It begins with an assessment of the child's life, looking at their stressors, their home discipline, and case management approach. Treatment in children are 95% effective. Treatment in adults tends to be a little bit more difficult. The reason for that being they are a little bit more uncooperative than children. 3 medications the adults are given are selective serotonin reuptake inhibitors, an antidepressant, and a monoamine oxidase inhibitor. Lastly, a local community support agency that I found in the area is the Saginaw County Community Mental Health Authority. They offer many services, a couple of them being counseling and transportation. The transportation can take you to doctor's appointments. You can reach this agency by dialing 211 or texting your zip code to TXT211. Being able to quickly reach help can be a huge game changer for this disorder. And lastly, these are the references I used for this presentation. That concludes my presentation. I hope you learned something about pyromania. And next, I'm going to be playing my clip of my activity. For my activity, we're going to be playing a trivia game, and we're going to keep score with the candles they have in front of them. They each have 3 candles, and if they get one right, they will light one of their candles, but they'll also get to choose someone else to blow out one of theirs. But if they get it wrong, they will have to blow out one of their candles. Question number 1. Does pyromania occur more often in females or males?
Males.
I heard McKenna first, so go ahead and light one of your candles. What is an example of a cognitive symptom seen in pyromania?
Obsession with fire.
Obsessive thoughts, so I'll let you light a candle. Any of those answers could have been agitation, irritability, lack of patience, difficulty concentrating, or obsessive thoughts. What is the peak age of pyromania?
12 to 14.
McKenna, go ahead and light one of your candles.
And you can blow out your candle.
What kind of therapy is treatment for pyromania?
Relaxation.
Yep, go ahead.
Can I have McKenna blow out a candle?
Yes. How effective is the treatment in children?
95%.
Good job.
Blow out your candle.
What number do you dial to reach the Saginaw County Community Mental Health
211.
Agency? Carly, go ahead and light a candle. is the abuse of drugs an etiology?
Yes.
Yes.
Well, go ahead.
McKenna?
What age is pyromania usually diagnosed?
18.
18.
Well, go ahead.
I'll let it slide.
Pyromania is what type of disorder?
Impulse
control.
Yeah.
McKenna, go ahead.
Bo.
And that is the end of the questions, and McKenna has 2 candles, and she has the most, so she wins.